I'm Dr. Shruti Tannan. I'm a board-certified plastic surgeon in Raleigh, North Carolina, and I want to talk to you about implications of a recent study from the Aesthetic Surgery Journal, which I think is very valuable to the plastic surgery literature and really important for a lot of you to know, as many of the population are on semaglutide or some form of GLP-1 receptor agonist in efforts to help them lose weight. And there are increased rates of complications in patients who are on semaglutide undergoing plastic surgery. So I want to talk about it, and I want to talk about some of the limitations of the study and implications for the future. So I'm just going to read a couple of key things. So over 4,000 patients who are on semaglutide were reviewed in this retrospective analysis of an electronic medical record database. So there are limitations to that already. But what they found in this review of 4,215 patients on semaglutide is that semaglutide patients had higher rates of wound dehiscence, delayed wound healing, surgical site infections, nausea, vomiting, diarrhea, hypertrophic scar formation, and surgical site pain compared to patients who were not on semaglutide and having the same body contouring procedures. So those are things like abdominoplasty, thighplasty, brachioplasty, big plastic surgery procedures. So what does this mean? How can you take this information and do something with it? Let me explain. So when they reviewed 62 healthcare organizations' data and compared patients and did this matching of different groups, they found that there were higher rates in people of complications in people taking semaglutide having these big plastic surgery procedures. They tried to make sure they didn't include patients with a bunch of medical conditions that could have caused these. However, the data we don't have is when did these people stop the semaglutide? When did they restart it? So that's a really big limitation. But there is some value to this study, and it's in knowing that there is a higher risk of complications. So what are things that we know about semaglutide, and how can we take this and move forward? I will tell you that we know that semaglutide, in restricting, these GLP-1, so not just semaglutide, but Wegovy, Ozempic, tirzepatide, Mounjaro, Zepbound. I want you to think about all of these when I'm just saying the word semaglutide. But ultimately, these GLP-1s will work by convincing your brain that you're full by slowing down the transit time of food from your stomach through your intestines. And so you think you're full, so you eat less. And it's very easy to be malnourished if you're not paying attention to the amount of protein that you're taking in. So if you have these people that are chronically malnourished, having a big surgery that requires a lot of protein to heal, and then they're having all this fluid losses and problems healing, they're going to have increased complications because they can't heal their wounds because they're malnourished. And then if they start the semaglutide too soon after, and they still are just continuing and perpetuating that malnourishment. So I certainly believe it. I think it makes very logical sense that if someone's malnourished, they're going to have problems in their healing. That's a key tenet of plastic surgery training and education. So one of my key takeaways for you is if you're on semaglutide or some form of GLP-1, or even if you're intermittent fasting, if you're trying to restrict your calories and you're undergoing plastic surgery, it's really important to share that with your plastic surgeon, to discuss what are our plans for increasing your nutrition around the time of surgery, because your body has very significant increased caloric needs as well as protein needs around the time of surgery so that you can have optimal outcomes. If you have wound healing problems, chances are your scars are going to potentially be problematic as well. So to optimize yourself to have the best possible outcome and a swift recovery to get back to your life the way you intend and hope for, collaborate with your plastic surgical team, talk about things you can do to optimize your healing, optimize your nutrition before, during, and after surgery. And it's really important to be honest with your team about your use of GLP-1s. There's a lot of folks who are microdosing and not sharing that information with their medical team or even their families. Communication is key. Follow us for more tips.